everybody. Very pleased to introduce Dr. Hicham Ait Mansour, who's an Associate Professor of Sociology at the Mohammed-V University in Rabat, Morocco. He holds a PhD in Sociology from the same university and a Master's of Science and Policy Research from the University of Bristol in the UK. He was also a Fulbright visiting scholar at the City University of New York Graduate Center in 2013-2014. Hisham's areas of research are poverty measurement, social policy analysis, political participation of youth, as well as knowledge production in the Arab world. He is a founding member of the MENA Social Policy Network based at the University of Bath and an associate member of the Arab Council for Social Sciences. Before joining academia, Hicham worked in several international organizations between 1999 and 2015, including Save the Children UK and UNICEF. So over to you, Hicham. It's a pleasure to have you. And I shall try to chair by chat, but thank you very much.
Thank you so much. Thank you so much, Rana. It's very good to see you all, Rana, Olivia, and all the team and friends who are attending today. Do you hear me well? Okay, I'm really sorry for the delay. I got some difficulties in accessing, but actually when I was in, Rana, I thought you told me, please mute yourself, not unmute. So I did mute myself, and then I realized that, yeah, it was time to start. So Olivia is managing the slides, or shall I share my screen? Yeah. Okay, so it's good to be with you today. I will try to share some insights from Morocco in terms of the social policy reform. This has been ongoing for a long time, for many years. I remember my first joint paper with Rana was in 2011, I think, and then we were asking questions about how we can make sense of social protection schemes and social policy schemes in the region, and I wouldn't say thanks to the pandemic, because it sounds a bit weird to say thanks to the pandemic, but it's one of the accelerating factors of many reforms that are ongoing today in the world, not only in MENA region. So I will start with some preliminary thoughts about how can we make sense of a social protection scheme in any country. Next slide, please. Next. Yes. Yeah, there are at least, I say at least two approaches to analyze welfare in general, not only social protection or social policy. The technical approach is to try to describe and analyze the income transfers and related social services in any country. The second, according to the very well-known scholar in social policy, Espen Andersen, is the political economy approach. Why the political economy approach? Because social protection reform is not only a technical matter. It is very political, and I think it's more political than technical. Once the politics are set, the technical aspects can be fixed very easily. So, and also as Tony Atkinson put it, I'm quoting him: social protection systems are entangled in a historical configuration of institutions, so that it would not make sense to import or export a model from one society to another. Of course, we can import or export an idea, but the very factors of success or failure are entangled in historical configurations and different phases in the history of reform or of establishment of any welfare system in any country in the world. So that's why the political economy approach is one of the best approaches to analyze welfare and social protection reform in particular because it's embedded in the local context and its social and political and historical configurations that one should understand to assess how and when significant reform can take place. And in this sense, the studies about the social protection in Morocco are mainly technical. So the political economy of, or the politics of social policy choice in Morocco are under-analyzed. There are some examples, one of which I will present in a second. But in general, the literature and researchers in the region, I think, at least from what I have learned in the last a few years, where we were in the network, we were trying to find models, theoretical models, or to build theoretical models that could explain what's going on in the region. Why do we have such large population who do not have access to social protection schemes? So why is this happening? And existing models or how can I say it? Or actually linking social protection to labor market. So if your labor market is weak, then it follows that social protection would be very weak in that country. But this is not, as we see, this is not really a relevant explanation. The next slide, please. We see how one of the models developed, political economy models developed to explain what's going on in Morocco. Shen et al. And a group of researchers at the World Bank back in 2014, they tried to explain the subsidized reform, the phasing out of the partial phasing out of the subsidized food subsidized and fuel subsidized in Morocco. So they focused on three aspects to explain what's going on in Morocco in terms of the social policy reform. First one is the increasing pressure of the government, especially after the Arab Spring, what so-called Arab Spring. The people's pressure on the government to expand inclusion and political participation and the reform of the whole economic and political system, and not only social policy. Social policy is only part of that. And also there is a rising demand for accountability, transparency, etc. So this first point actually is a very strong one, and at least apparently political systems of the region after the uprising try to respond to that in different ways. Second point is concerning Morocco, and I think there are some overlaps with Jordan. Here is the historical concentration of power and decision-making in the monarchy since independence. And this left small room for deliberation and political discussions about policy choices. But after the constitutional reform in 2011, there is more room for the government to be held accountable in terms of the policies they adopt and they apply. And the third point I think is very important too, is the business environment, especially the strong alliances between big companies, big business people and governments. And this limits also the capacity of the people and their representatives to deliberate about what would be the best policy choice to expand social policy in the country and in the region as a whole. Next, please, Olivia. Yeah, so I think this model is good, but it's not. It leaves out very important factors that contribute to the process of reform in Morocco, and I think it's the case in many countries in the region, because it doesn't take into account the influential role of international institutions like the World Bank and IMF and ILO, etc. For example, although the ILO position was in many ways very different from the World Bank as a bank. So these researchers have written this paper for the World Bank, and curiously, they don't mention the role of the international financial institutions in the processes of social policy reform. And indeed, the World Bank has supported many programs and loans also to the government of Morocco to study the possibilities and options of social policy reform. So because of these shortcomings of this model, I think a good model to explain what's going on in the region is to include as well the role of international institutions, because its historical role goes back at least to the structural adjustment program in early 80s, but also other factors like demographic transitions, for example, and its very important implications on the policy processes and outcome, especially when it comes to social protection and the life cycle approach, children and the working population and the old age pensions, etc. So the demographic transition has huge implications on social policy reform, and no country, whatever the political system is, can stay blind to the demographic challenges. So there should be some responses to the demographic challenges anyway. So to conclude this part, I think we cannot import models like those, for example, that Ispin Anderson has applied to the Western industrialized countries. We need to develop models that are more adapted to our countries and the state of development of our countries in the region. And we can use, of course, models that have been developed to explain social protection models in the West. We can think with them, but they are not enough to account for the dynamics of political and social and economic policies in general, and social policy in social protection in particular. Next, please. Yes, yeah, there's just a time issue here. Yeah. Next point is there is huge literature in terms of economic growth and welfare. Whether really economic growth should be considered as a precondition for a welfare state or the opposite. So if you look historically in the welfare states in the West, actually it was the welfare state that allowed economic growth to be possible, and not the opposite. While since the 80s, in the neoliberal orthodoxy literature, the strongest point was always, at least implicit, if it's not explicit, it was always implicit in that literature, is that economic growth should be considered as a precondition to start to expand social protection coverage in any country in the global south, because of the lack of triggering factors like industrial revolution, etc. So many authors and social policy scholars disagree that economic growth should be considered as a precondition to the expansion of social welfare. And I tend to agree, and there are many studies, and I will quote one study in the next slide or so. Please go ahead, Olivia. Yes, according to a study conducted by ILO in 2007, Morocco and other countries like Philippines, Jamaica, India, and many others are richer today in terms of GDP than France in 1905 when it established its first universal social security system, and it's the same for Denmark, for example, in 1892. So we cannot really understand the claim that economic growth should be a precondition to the expansion of welfare. Rather, welfare would help to enhance economic development. Okay, so yeah, next, please. Demographic transition, I will not go into the details of those indicators, but it has huge implications for social policy. And as you can see, there is a total transformation of the population structure, and the current social protection system cannot at all face those challenges. So there is a need for total transformation, not reform. I think reform is very weak word. Transformation, it needs a total transformation of the social protection policy. Next, please. Next. No, please go back one. Yes, before COVID-19, the situation in Morocco was as follows. For example, I'm giving just a few examples. 1 in 10 workers lost access to social security before retirement in the agricultural sector, because the agricultural sector is where there is the majority of people, and the informal sector in cities as well were not covered. So 1 in 10, even if when they had access to social security, they lost it. They lost it before for a duration of less than 6 months period. Only 15% of women and 37% of men working in this sector were declared for 12 months, and etc., etc., etc. So as a result, if you take into account the agricultural sector plus the informal sector economy in cities, the result is that 2/3 of active population were not covered by any pension regime, and 46% were not covered by any health insurance. Why 46? The difference between 60 and 46 is that Morocco has established a social assistance medical program in Morocco for the poor. So that covered like 8 million in the last 10 years. But for the other sectors of social protection, it's like the first indicator. Pension is one of the markers of the situation of social protection scheme in a country. Next, please. So, children, for example, disabled people and employed did not have any access to any scheme, as well as informal sector workers. I already mentioned that, independent workers, self-employed workers in cooperative, etc. And when I say self-employed, even people who have the means to contribute were not included, because the system was so rigid and could not include even people who could contribute. Okay, and there are other populations. For example, according to the report of Economic and Social Council in Morocco, published in 2018, women in rural areas, single mothers, children with the most vulnerable, detained children, children living in the streets, old age, the poor, the socially excluded, etc. There's a large population left behind the current social policy scheme. Next, please. Okay, so we knew that the social protection policy in Morocco was not adequate, and it left out more than the half of the population, 60%. So what COVID-19 crisis and the emergency did is that it only magnified and it actually accelerated. Nobody could disagree. it showed the depth and the breadth of vulnerability among workers and households in Morocco in a very, very clear way, as we will see in the next slide. Next, please. So after the lockdown that lasted 3 months, public sector people, except security and other vital areas, shifted to the distance work, the remote working. But the majority of workers in Morocco who are active in the private sector, formal and informal, lost their jobs. The majority lost their jobs. And after the creation of the special fund by the Moroccan government, entitled the Special Fund for the Management of COVID, people had to apply for a stipend, so a cash transfer, to compensate for the loss of jobs. And through this self-declaration, the government of Morocco was able, and social policy scholars as well, were able to have a clear and more precise idea of the depths of vulnerability of workers and households in Morocco. Next. Next, please. Yeah, so in the beginning, this fund of the COVID management was initially designed to rehabilitate the health system, especially in terms of equipment, and also to support the national economy, but not explicitly to help households. So it's actually when the authorities, when the government realized the large scale of vulnerability in social protection coverage and the numbers of people who work in the informal economy, that the government decided to extend the support to households who lost their sources of income. Next, please. So as you see in these figures, give us a very clear idea. Typology of transfers can be used as a mean to identify the vulnerable household in Morocco. So the private sector, people who are affiliated already to Social Security, they had access to a little bit more than $2,200 per month, okay, in addition to family allowances and medical insurances. So these people, no problem. The problem starts here. Households who are active in the informal sector, so we have two types of households who are active in the informal sector. Those who were already recorded, already known to the government, those who benefited from the medical insurance for the poor, Rabat. So for any household with at least 2 persons, they got 800 dirham, Moroccan dirham. More than three to 4 persons, 1,000, and more than 4 persons, 1,200 dirhams. And last but not the least, the households are not affiliated to any social security or social assistance. They also were eligible for the cash transfer and the same amounts as for number 2 applied to this. Next. So, what is the result of this cash transfer operation? 6 million households, that is almost 70% of the Moroccan total number of households, have applied to the cash transfer program from the special fund. So as you can see, only 500,000 were affiliated to the Social Security. 5.5 million households received the stipend dedicated to the informal sector. So this is huge, actually. We suspected it was around 3 million or 3.5, etc. But this comes from the statistics of people who applied. They self-reported that they work in the informal economy, and even if they applied, they had to go through an application system and cross-checking whether the information was reliable, etc. So these numbers are accurate in that we know now with certainty that 5.5 million work in the informal economy. So you cannot construct a strong economy with this fact. And this is what actually accelerated the discussions that have been ongoing in Morocco about the social protection reform since the last 10 years. But actually, the government of Morocco, based on this data, have taken the strategic decision to adopt a universal social protection coverage and to limit social assistance to very, very small groups. Next, please. Am I on time, Rana? Okay. Okay, I would conclude this second section by saying that societies like Morocco, where the majority of labor force operates in the informal sector, are no longer the cohesive traditional societies where the traditional family and community played the role of social protection, but they have not either fully replaced the traditional social bond by social contract, including social protection, as well as civil and political rights, because these go hand in hand. In the beginning, I said that social protection reform is not technical, it's political, because you have the civil and political protection, access to human rights, etc., and freedom of press, etc., freedom of expression, but also social protection, which has to do with economic and social rights. So we are facing this challenge, as you have seen with the demographic transition that is fully achieved in Morocco. We don't have anymore the traditional ties that used to mitigate crises like this, and we don't have yet, as Marcel Mauss, the French sociologist of the first half of the 18th century, 20th century, said that social protection replaces the traditional social bond. Okay, next, please. So this is the response of the government of Morocco after they realized that majority of population actually live from the informal economy, which is very vulnerable and cannot resist to shocks. There was a law adopted a few months ago, but it was announced in the aftermath of the confinement, the establishment of a universal social protection scheme. Okay, that would extend to an additional 22 million by 2022. Extend family allowances for about 7 million and 3 million households. Extend the pension to 5 million among the economically active, and extend the unemployment allowance to Moroccan workers engaged in regular economic activity. Okay, so today Morocco has like 120 social policy programs. So these will, some of them will be phased out, some of them will be included into the new regime. So this reform will last 5 years. Next, please.
Sorry, Hicham, so 5 minutes left, please.
Yes. Yeah, it's more than enough. Thank you, Anna. Okay, so the first phase started already up to 2023. Will be dedicated to the health insurance, medical insurance, and children's allowances. The second, between 24 and 25, will be dedicated to unemployment allowance and pension scheme. Okay, this is a law adopted. It's no longer just an announcement. It is a law adopted by the parliament, and all the financial engineering, etc., is ongoing at the moment. Okay, next, please. The financing, as you would say, because the plan may seem too beautiful to be true, but actually there is a clear, in the law, there is a clear outline of how this will be funded. It will be funded through two mechanisms. The first one is contributory, because there are people who are not poor and who can contribute. Of course, they contribute and the government covers its part as well. Second is a solidarity mechanism in favor of low-income groups. This solidarity mechanism will be funded through state budget, tax revenue dedicated to social protection, the resource recovered from the ongoing phase out of subsidized fund, and donation and bequest at the end. Okay, to the next, please. The estimation of the total amount required annually is 15 billion Moroccan dirhams. That is almost 5 billion US dollars. Okay, so to give you an idea, this is 5% of the Moroccan current GDP. So this would be a huge challenge to meet this annually. And this would require, actually, it's not enough. Those sources of funding that I just mentioned would not be enough, because this requires a total transformation of the tax policy. And this will not be easy. The tax policy, because as you have seen, the length of the informal economy is so huge. So those who are declaring taxes and affiliating their workers into social security are only 500,000 employees. So it's those who are contributing regularly to the direct income tax. Of course, people who work in the informal economy, they pay indirect taxes like VTA, etc. But a lot of income is lost in terms of income tax in the informal sector. So I think this is the most challenging point, is to transform the tax policy, because there are lots of lobbies and resistance and strong business groups that would not really easily adhere to a total reform of taxes. Next, please. So I will conclude with this nice quote from Marcel Mauss, The Gift. This study was published, Essai sur le don, in 1925 and translated into English in very recently. The latest translation was taken in 2002. Marcel Mauss says, all our social insurance legislation in France, of course, is inspired by the following principle. The worker has given his life and his labor, on the one hand, to collectivity, to the community, and on the other hand, to his employers. Although the worker has to contribute to his insurance, those who have benefited from his services have not discharged their debt to him. So it's not enough wages are not enough as a counterpart to labor. Okay, so it's the worker, according to Marcel Mauss, owes to the employers a certain security in life against unemployment, sickness, old age, and death. Next. Thank you. Thank you very much. I think that the quote from Marcel Mauss is very thoughtful in a way that it distinguishes implicitly between social security, which is a right, and social assistance, which is more close to charity than to what we would hope our societies look like in terms of social justice and distribution of wealth and of the economic output that everybody contribute to. So likewise, they should get their share from that economic output. Thank you very much. I hope that it was on time, Rana.
Very much so. Thank you so much, Hicham. Very interesting. Sorry if we had to shorten anything. There's a lot more behind this work. I'm not sure if you'd like to circulate the paper that this is all based on or the report. So feel free to let us know, and we could circulate that to everyone so they could read the report you produced. Yeah. Okay. So colleagues, I think yeah, we're aiming to finish by 2 o'clock roughly. So if you'd like to pose questions to Hicham, either in the chat or in person, please feel free to unmute yourself or just post your question through the chat. And thank you to colleagues who have to leave us, but for joining. So that's great. Yeah. So questions, everybody, for Hicham.
Yes, can I just ask one question, Rana?
Yeah. Hello. Yes. Hafiz,
Yeah, yeah.
to introduce yourself.
Thank you very much. You know, my name is Hafiz Khan. Actually, I'm a professor in public health at University of West London. Professor Hicham, actually very interesting talk. You have given wide spectrum scenario in Morocco. I enjoyed your talk. So my question is about actually social protection for older people in Morocco. Because we know during the COVID time, the older peoples are affected mostly in many countries. And we have also the bad experience in the UK. So to what extent actually the older peoples in Morocco was affected during the pandemic time, and what actions are taken during the pandemic time in Morocco. So if you could actually elaborate it a little bit, would be very useful for us. Thank you.
Thanks, Hafiz. Everyone, can I suggest that we do a round of questions first, and then we give Hicham the chance to respond? So would anybody like to pose any more questions, either directly or in the chat? Okay, well, I'll take the opportunity of the silence, Hicham, just to pose a couple of questions myself, interlinked questions.
Yes.
So thank you very much for the presentation. So in the World Bank Gini Index data, Morocco comes up as having the highest level of inequality, according to the Gini Index, amongst the Arab countries. Has the issue of inequality figured at all in the government response to the COVID-19, or has it motivated the government response in any way? And related to that, again, these sort of global financial forecasts. So again, for Morocco, as other Arab countries, for the next few years, it seems that there are major budget deficits that the governments face in the region, including for Morocco. So just wanted to ask you how far you feel the reforms that are proposed can be effectively financed, especially given some of the resistance around taxation. Thank you. Shall we respond to those questions, and then we'll see if other colleagues want to ask?
Okay, these are very, very tough questions. As you know, social policy is interdisciplinary, and every discipline tries to shed light on parts of what's going on. Although I'm interested in economics, I'm not an economist. So I have not really looked into the details of the financial forecast and the details into the income tax policies, etc. But as I said in the beginning, this is very political. It's not only technical. It's not about accounting and finance, technically speaking. So if the government has adopted this law, so they should leverage the money from different sources. And I forgot to mention that the subsidized fund that will phase out as a result of this reform has already like half of this of the budget that is required to fund social policy reform. So let's wait and see how this will be. I'm sure there will be some reform of the tax policy, because last year the government held a conference on, not conference, but some kind of policy forum about reforming tax policy in Morocco, and they started to really to leverage, because this cannot, any reform cannot go to this this level of universality, cannot be done without a true tax policy reform. So let's wait and see, and this actually indeed, Rana, need to be monitored closely and see whether this will be effectively implemented as it is stated in the law. But it is also included in the finance law, because finance law is annual. I don't know what is the equivalent of finance law in England. It's annual. It has a forecast of the income during the year and the expenditure on the other hand, including the money that goes to the job creation and redistribution, etc. So through the finance law, we would be able to see whether we have this 50 million Moroccan dirhams or not. As far as inequalities are concerned, there is an official recognition in Morocco about inequalities, and many studies produced by the official institutions, not only critical researchers and scholars and civil society, but also institutions like Economic and Social Council in Morocco. Morocco has this particularity that the government itself produces critical reports. The problem is when it comes to the reform of the policy and implementation of those recommendations that it gets stuck somewhere due to many factors. For coronavirus, it was very clear that the level of inequality in all sectors, not only in social protection, really made the people situations worse. And the government really felt this, and you know, you cannot go beyond certain limits because it has to do with stability and security. And I think this is why they adopted this special fund where people got cash during 3 months, and there was extension for certain sectors up to December, actually, for those who lost their jobs, those who work in the tourism sector, got the stipend until December, not only during the lockdown. And this is why they accelerated this reform, because without some security, we cannot reduce inequality, because inequality is not only income inequality, but also inequality of opportunity. You have people who lose their jobs and they have a source of income, and you have the majority, even if they are not poor, not all of them are poor. Many are poor, but none of them are poor. But if they lose their source of income, then they become more than poor. For the older people, indeed, if you look at statistics, the pension marker is very significant in this regard. The older people are the most marginalized in Morocco. People who have been working the whole of their lives in the informal economy, and they have raised families, etc., and they find themselves after retirement. Retirement between brackets, retirement from work, but not the retirement which is attached to entitlements. So there are some studies ongoing. I have seen that some researchers are getting interested into the situation of older people, but during the COVID-19, the only thing that I have noticed is that the government have given the priority to older people in terms of vaccination campaign, and Morocco was among the first to start vaccination of the population, and they gave priority to the older people including in vulnerable areas, and there wasn't actually any discrimination in terms of vaccination. That was very well done, but economically speaking, only those who were active, economically active, were entitled to that cash transfer program. So the people who are not economically active were actually represented by one member of the household who was economically active. At least one member of the household was entitled to get the cash transfer for the whole family. But I'm not aware of any, for Hafiz, I'm not aware of any specific initiative toward older people during the confinements and after. Okay.
Yeah. Thanks. Yeah, and I think that you've raised an interesting point there, which is a lot of the prioritization has gone towards employed people, whether in the formal and informal sector, and older people, people with disabilities and special needs. Those categories have been looked after by their families, and perhaps easy to miss in this current context.
Yes.
Hicham, colleagues, would anybody like to ask any other questions or post questions through the chat to Hicham?
Yeah, there is a question in the chat actually.
Oh.
Right, so come, no, how can we form?
Oh, sorry if I missed this. Dr. Ali Saidi from University of Tehran, very nice to have you with us. So I'll just read the question out. I would like to know what are the limitations of reform in this situation, i.e. the pandemic? How can we reform our social protection system in times of pandemic where there is no perspective for the end? Yeah, so we can't see an end in sight, and so how can you respond effectively to the pandemic?
Yeah, Ali, thank you, Ali. I tend to agree with you about the pessimistic view. I'm naturally a pessimistic person, but my paper and presentation did not focus on the reform during the pandemic, but how the pandemic triggered or accelerated a reform that was in the pipe in Morocco since at least 10 years and did not reach any concrete result in terms of the universality. And my argument was that the pandemic had a magnifying effect to see clearly the segments of population that are vulnerable. So when you have 70% of the population living from the informal economy, this is, as we say in French, bombe à retardement. It's in terms from security point of view, from
time bomb, yeah,
time bomb, yeah, time bomb, and you cannot afford to close your eyes on that. You need actually to address, because it becomes very serious, and especially in times of crisis. Imagine if people could not afford to eat during the lockdown. What would happen? So, yeah, I think the pandemic should, we should learn from the pandemic how to think differently. I don't think that we should think for the pandemic, but we should think how to think differently as a result of this experience. And we have seen that we have seen some surrealist things. So I don't know if you remember this plane holding masks for a country and had to land for fuel in Spain or Portugal, and they just hijacked the plane to take control of the 2 million or 3 million masks, and this was very funny actually. during the pandemics, we can see things that we were not able to see before, and I think we should learn from this experience on how, as scholars, how we should think differently, but also how to push decision makers and expose their shortcomings in the management of crisis, but also in terms of policy reform in general.
That's great. Thank you so much. I'm sorry to have to bring the conversation to an end. We've sort of reached the end time. And I'll just note, though, that there was a comment as well before he left from Tariq in the chat, who mentioned that this process is quite political in nature, which is kind of the million-dollar question that a lot of us are dealing with in many countries. I just want to thank Hicham again for this really interesting presentation. Hopefully we'll keep the conversation going, and please, colleagues, connect with each other. Without further ado, I wish we could take you all out for coffee or for lunch or for anything like that. We're obviously going to stay online, so everybody's welcome to stay and chat for a bit if you like, and not necessarily switch off. Otherwise, I just want to thank you all, and maybe we'll invite Hicham next year to give us an assessment of how well Morocco has performed. Yeah, but certainly lots to think about in the management of crises, and maybe how, in my thinking, the MENA countries often react to crises, and hence their development of social protection policies tends to be a little bit reactive in that way. Yeah, and I suppose it's how we move beyond that. I think Morocco clearly has used the opportunity to think progressively. So good luck to that. Okay, so thank you all. Please stay in touch and hope to see you soon. Bye for now.
Thank you so much. Thank you so much, Rana. And as usual, I felt very welcomed, like we were in Bath in the pre-pandemic times. Thank you so much again, and thanks everybody for coming. And of course, you can circulate the paper, and I would be happy to get any comments, critiques. I'm following this very slowly, so it's work in progress, and any comments are welcome. Thank you very much.
Thanks, everybody. And as always, our silent soldiers, Islam and Olivia, thank you to both of you for all the background organizing that you do. That's indispensable.